think one of our key challenges is that the numbers of women with type 2 diabetes in pregnancy is growing markedly year on year. And that means that although this was a very uncommon disease 10 years ago, it's now a very common disease within the antenatal population. And that creates challenges for clinical services in terms of knowing how best to treat women. One of the major things we're trying to improve is also those maternal baby outcomes after pregnancy. So we know that women with type 2 diabetes face higher rates of pregnancy loss. And we know that babies born to mothers with type 2 diabetes often need extra care in the neonatal period.
The census statement was driven by a group of clinicians and scientists who came together because we were increasingly worried about the number of women entering pregnancy with type 2 diabetes and their suboptimal outcomes. I think that we were really surprised by, despite the fact that type 2 diabetes is increasing in our communities, we're seeing much more in our pregnancy clinics, but the evidence base behind our practice is really lacking. Most of the studies really concentrate on glucose management, which clearly is extremely important, but we're missing innovative thought processes behind technology that's moved forward enormously in type 1 diabetes, but hasn't in type 2 diabetes, tackling weight management in a way that is appropriate for this group of individuals, and also postpartum, so post-pregnancy, post-birth, having the appropriate tools to pick up individuals who need support with innovative approaches that can improve their long-term outcomes, so not just around pregnancy, but also if they're planning a second pregnancy or a third pregnancy, how we can improve their quality of life and their pregnancy health as well as their long-term health.
Are there unmet needs related to type 2 diabetes care within weight management?
Yeah, so along with the increasing prevalence of type 2 diabetes in women and early onset type 2 diabetes, we also see a parallel increase in maternal obesity prevalence, with between 1 in 4 and 1 in 3 women starting off their pregnancy with a BMI in the obesity range, and there's huge geographic variation in that prevalence. Women living with obesity also experience very high levels of stigma. Ensuring that care doesn't increase experience of stigma is really important, because we know that experiencing stigma can be really harmful. It can be harmful for mental health, it can be harmful for physical health, it can make obesity and health behaviours worse, and there's kind of really important impacts of women experiencing stigma. So it's important that any services and care that are delivered are in an empathetic and supportive way, rather than increasing stigma in this group.
There are particular challenges facing women with type 2 diabetes that impact upon their ability to access care.
Well, women with type 2 diabetes are more likely to come from ethnic minority groups and areas of higher deprivation. And so this further widens the inequalities that they face in accessing any care.
We found 3 things were really important in terms of planning pregnancy. One was sugar levels or glucose levels on entering pregnancy. A second one was maternal weight, so women's weight or BMI when they enter pregnancy. And a third one was the amount of weight gained during the pregnancy. And those 3 things were really important in terms of looking at mother and baby outcomes. Are there other concerns that you have related to the complications of diabetes in pregnancy?
We're increasingly seeing individuals who have hypertension, so high blood pressure. They may enter pregnancy with with kidney problems already that need managing through pregnancy. They tend to be older. Often they're living with obesity, so they come into pregnancy with many more risk factors for potential poorer outcomes during pregnancy, but also beyond. We see eye complications in pregnancy, and actually probably seeing more complex. We're certainly seeing more complex pregnancies in individuals with type 2 diabetes now, probably, than we are seeing with type 1 diabetes. So really,
one of the key goals is to produce recommendations that improve UK care for women with type 2 diabetes before, during, and after pregnancy. And we found that there was a lack of information available related to women's care during those 3 key time periods. One thing we'd like to achieve in particular is an improvement in preconception care. So that is care for women before pregnancy, whether they're planning pregnancy or not. And it's really important, isn't it, working with primary care to get really good care for women before, during, and after pregnancy with type 2 diabetes. Can you tell us about some of your work showing that preconception care also needs to improve?
Absolutely. And if we look at the prevalence of type 2 diabetes pregnancies, women with type 2 diabetes now account for 60% of pregnancies amongst women with established diabetes in the UK. And this number is also increasing in Ireland, with almost 40% of women with established diabetes having type 2 diabetes. Women with type 2 diabetes are less likely to be prepared for pregnancy than those with type 1 diabetes from a diabetes perspective, considering the criteria for pregnancy planning amongst this group. And this can be attributed to factors related to the healthcare systems, the healthcare professionals, and also factors related to the women themselves. And one of the big features in relation to women with type 2 diabetes is that their care is primarily delivered within primary care, unlike those with type 1 diabetes who receive specialist care. The challenge within the primary care setting is that the focus is not always on the reproductive healthcare needs for this younger population of women living with type 2 diabetes.
There's lots of work that can be done really effectively in primary care to help women with type 2 diabetes plan for pregnancy. And we know that that's prioritising things like glucose levels, also blood pressure, weight, and providing support more specifically for pregnancy planning and use of folic acid. We know that good nutrition is a really key part of good diabetes management. Are there unaddressed needs for women with type 2 diabetes related to nutrition?
Yes, in the UK and Ireland, there are major challenges in terms of nutrition support for women with type 2 diabetes from preconception to postpartum. It's really important that women with type 2 diabetes have access to appropriate dietetic advice that's culturally relevant to them and that takes into account their social and demographic factors.
Thank you.
So there's multiple intersecting stigmas that women with type 2 diabetes and women with obesity might face during pregnancy. So for example, quite often you'll see in newspaper articles around the risks of maternal obesity, the blame is put at women's feet for any potential for increased risks to the baby. So it's really important to understand the exposure that women have to blame and stigma.
And are there things that we can be doing to further support women in planning healthy pregnancies?
I think there's a number of things that can be done. And the first one is about awareness raising. And it's awareness raising about the relationship between diabetes and pregnancy, and that there is a connection between diabetes and pregnancy, and there's a need to plan a pregnancy from a diabetes perspective. Because most women, when they think about planning pregnancy, they're thinking about their family and planning a family as opposed to planning a pregnancy. If women are actively trying to conceive, they need to be supported in relation to all aspects of their diabetes care, including medication management, and this includes supplemental vitamin supplements such as folic acid supplements. And for women with type 2 diabetes, they're considered high risk in relation to pregnancy complications. Therefore, they need a high dose of folic acid, 5 milligrams of folic acid, which does require prescription. And they also need to be considered in relation to their general medication management in relation to their type 2 diabetes medications and the condition and the medications for other conditions related to their type 2 diabetes.
So are there key areas of recommendations that you have in terms of funding and opportunities to improve care?
Really believe that there is a need for investment in research in this group of for this group of individuals to improve both pregnancy preparation, pregnancy outcomes, but also long-term health in these women, because pregnancy is an excellent moment to educate, re-educate improve to improve our outcomes long term for these individuals who have many years of type 2 diabetes ahead of them.